This is the mayor of the airwaves. Good morning, I'm Rhett Palmer. You and I in a series of getting and staying healthy together. And my friend Dr. William Frazier is back in the studio again. Good morning, Dr. Frazier.
Good morning, Rhett. It's nice to be here.
Nice to have you here as always. Vero Cosmetic Surgery and Medispa. And today we're going to be talking about, among other things, liposuction, first of all, anyway. You also have a practice with Dr. Bailor, and differentiate what you do from what she does.
Well, Dr. Bailor's training is specialized in cosmetic surgery, principally of the head and neck. My practice includes also reconstructive surgery, breast reconstruction, liposuction, skin cancer reconstruction, and so it's a broader-based area. Her specialty is special interests are narrow, and that's where she has all her special training.
And you're very pleased to have her. You said
she's a real delight. I've operated with her. She's just technically excellent, and she thinks well as a clinician. I really like that.
Wonderful. Okay, so let's talk about liposuction. Now, liposuction is not for dieting. It's body contouring. Okay, expound on that.
Well, I think a lot of times people think of liposuction as a way to lose weight and to change their shape. And liposuction will remove very modest amounts of weight, and so I don't even think about the weight aspect of it. It's really about what the person's shape is. So ideally, they'll get to pretty close to their ideal body weight through dieting, changing what they eat, some exercising. And then when they reach that close to ideal weight, then we can start working on shape. And typically with even a circumferential liposuction, in other words, you liposuction the hips and waist and the flanks, you only remove 8-9 pounds. So it's not weight, it's the shape.
And yet I remember when I was younger and Kenny Rogers was at the top of his craft and on the charts, I remember he had a little bit of a belly there, and he would frequently get liposuction. It was when it was brand new. And now you're telling us years later, really, it's not, I mean, 10 pounds is not that. So what's the flank?
Flank is the sides. When you put your hands on your sides.
Some people have that little bubble going around.
Exactly. It hangs out over the side.
And so even if you lose weight, it's still going to stay.
Yes.
How about people when they gain weight in the belly and they get so fat they have a second belly? Then they go on a diet and they start to work out and they're really trimming down, but they still have a little bit of the shadow of that second belly, which, if you were going to disrobe with another human being, you would want the lights to be out. Is that what you get rid of? Is that liposuction?
Sometimes that's just fat, but usually that's skin that's been stretched out and may not have enough inherent elasticity to shrink back down. But for men, most of the fat that they have, or more of it, is inside the abdomen, so it's not so amenable to liposuction.
Now, what do you mean by inside the abdomen?
It's inside the muscular part of the abdomen. It's around the intestines. Whereas for women, it tends to deposit on the outside.
So it's easier to suck it out from a woman.
Exactly.
With a man, it could be dangerous because you could possibly.
Yeah, you can't suck it out from inside the abdomen, but you can do the flanks, the area
the sides.
that comes out over the belt line.
Yeah.
And then that fold that you were talking about, that you can deflate with liposuction. And if there's still some loose skin, then tailoring that at a little bit later date would be reasonable.
It must be great when somebody who has put in the effort, it's kind of like having a Habitat home. People think it's a giveaway program when in fact it's not. You have to cultivate a good credit score. They loan you the money. It's a non-interest bearing loan. You also have to put sweat equity into other people's homes as well as your own home. And kind of with this, if you're doing liposuction, as you said, not for dieting, not to replace dieting, somebody has got to earn coming down a weight, then they get to come see you, and then you do this reconstructing, the body contouring. Sort of an extra gift they get for putting in the effort.
Well, and in the process, they get more healthy for doing all the things.
Why? How is it more healthy?
Well, because they've changed their diet.
Oh, yeah,
they've given up the carbs and all the sweets, and they're having a more appropriately balanced diet, and they're doing some exercise. It doesn't have to be a lot. We always say that 95% of a person's weight is from what goes in their mouth, and 5% is related to exercise.
Yeah.
So it's really dieting
Now, is this
important.
Now, I've lost 30 pounds recently.
Congratulations.
But thank you. Doing protein shake in the morning, then maybe a couple eggs, working out. Now, and then doing the same thing in the afternoon. I've been told if I don't do the protein shake somewhere between 2:30 and 4 o'clock, I will cheat. So what I do is I go, I'd really like to have that. You can have it if you have your shake and still want it. Of course, when I have the shake, then I don't want it. It kills the appetite. So it's playing a game with yourself, too. And I remember that guy used to represent the Subway sandwiches. He was on my show a few times, and I never met him face-to-face, but over the telephone. And he said when he lost that 254 pounds, actually hunger became his friend. So if I have a slight hunger as opposed to being full all the time, then I'm saying, I'm progressing. Because anytime I'm feeling just a slight bit of hunger, not over. Would you agree, though, that exercise does, in fact, create a fat-burning machine?
Well, you have to exercise an awful lot to burn a significant amount of fat, a lot. But what exercise does is it changes some of the body chemistry so you're not inclined to eat as much. And what you were saying before about sort of tricking yourself to not wanting to eat, what you're really doing is managing your insulin and your glucose level. So you don't get these swings. If you have a bowl of ice cream, then your glucose goes way up, your blood sugar goes up. And then your pancreas starts to make insulin, and that pushes the sugar back down. And then you feel tired, and you start to get hungry, and you feel sleepy, and so on. Yeah. And so what we're doing, though, by having more protein and these medium-chain fats, like coconut oil, for example, is keeping an even amount of glucose. You can burn the fat easily, and you don't get those mood swings and those sugar swings.
You were talking about that before we went on air, about cooking my scrambled eggs in the morning, not with butter, with either olive oil or coconut oil.
Yeah.
And why? Is this for sure a for sure thing? It's definitely...
Absolutely. Those are medium chain fats that your body can burn very easily, and you don't store as fat. You burn it. It's like 98% burnable. And so what we're seeing is a lot of changes in the thinking about what's reasonable to eat. It used to be that you should only have one egg a week because it has cholesterol in it. Well, it turns out that cholesterol is made by your liver, not by eating the eggs. And that eating eggs is a very good source for various nutrients. And the same for the olive oil and coconut oil. So things that in the past were considered as no-nos now are really embraced. And I think I mentioned to you that I have two sons that run these ultra marathons, 100-plus mile races, and they eat 60 to 80% fat.
Really? The nuts?
They'll eat a lot of nuts, a lot of avocados. If they're going to have butter, they want grass-fed butter. That is, cows that are only on grass.
Now, there really is a difference?
Big difference. Yeah, it's
really?
Very healthy. And the same for milk. Milk is okay if it's grass-fed, but if it's feedlot, that's not good because they're being fed corn and wheat and other things. Cows don't normally eat corn. They eat grass. So it's interesting.
We know for a fact that makes a difference. So look for grass-fed beef.
Grass-fed beef, which you can buy at places like Publix and Whole Foods.
The green wise.
Yeah, green wise. You can find grass-fed butter, Kerry Vale butter. You can find grass-fed yogurt and milk.
Really?
Yeah.
I'll have to look into that. Let's take a break, all right?
Sure.
Okay, you and I in a series, ladies and gentlemen, of Getting Healthy Together. My friend Dr. William Frazier is back in the studio with us today, plastic and reconstructive surgery. They have their practice on 37th Street, Suite D. You can reach them 562-2400, 772-562-2400. When we come back, how does liposuction work? Will those fat cells come back, or do they go somewhere else? Lots of questions to ask with Dr. Frazier, who's been doing this for quite a while. We'll be right back.